I read in your book that the statistic was that 50% of men over 40 show some signs of erectile dysfunction, which, by the way, it's a marker for more important diseases and troubles, not just performance and quality of life. But if you guys are watching, if I understood this right, these PD5 inhibitors, they work only when you have proper nitric oxide production. Because we get a lot of guys that depend on these, or they think that they depend on these medications, and sometimes they don't work, and they get super frustrated, right? And the psychology gets even worse.
So these drugs potentiate the effects of nitric oxide.
Wow.
They are not nitric oxide donors. They don't stimulate or activate nitric oxide. These drugs' efficacy is dependent upon nitric oxide production. So if we get to the root cause of treating erectile dysfunction, or really any major chronic disease, you have to restore the production of nitric oxide, which leads to normal vasomotor tone, prevents vascular inflammation, and basically makes everything better. So it's foundational. You cannot fix any chronic disease without first supporting the blood supply and oxygen nutrients to that individual organ, tissue, or cell, and nitric oxide is the master regulator of that.